Good afternoon to everyone, and thank you so much for joining. This is exciting to be able to talk to you about steps to constructing research and QI posters. And thank you, Sarah, for that lovely introduction. I certainly appreciate it. My colleague, Dr. Terry Peach, will be on helping with moderating the question time. So let's get started. I have no industry relationships to disclose, and I won't be discussing any off-label use. So at the end of this presentation, hopefully everyone will feel very comfortable with being able to identify the steps in constructing a research and quality improvement poster for scholarly presentations, and to describe the design or layout of posters, and also to find ways of facilitating the audience's understanding of your poster content. So what is a poster? I'm sure you're thinking, well, for heaven's sakes, I think I know what that is. But let's talk a little bit about that. A poster is a visual presentation of your research study or QI project. So when you really think about that, think about the amount of time you invested, and your team perhaps, in actually conducting a research study or a QI project. It's a lot of time. And you are trying to take all of that information, the results, etc., and put that into a visual depiction. One large piece of paper, so to speak. It is a unique hybrid of an oral presentation and written paper. So if you think about that, if you were preparing for an oral presentation, sometimes those are 30 minutes, you've got the PowerPoint, sometimes they're even longer, but you have PowerPoint to produce, and you're speaking to whatever audience you have. And or a written paper could be, what, 10 to 12 pages that you're trying to publish. So what we're doing is taking all of that information and actually putting it into a visual for someone to be able to look at. So why construct a poster? Well, I think it's really important because it can convey key information in a format that can be perused in minutes. So if you think about the time that people will walk through, if you've done this yourself, I'm sure, walking through, looking at different posters, and you take a few minutes. Did it attract you? Did it engage you? Did you decide to go and look at it longer? So the key information is really important, and it gives that picture of that entire study or project that you conducted. It's an excellent way to tell your story, and it's a wonderful method to increase networking. I find that networking is one of the most positive pieces at conferences or conventions. And when you're doing a poster, you have people coming up to you. They may be researchers, or they may be doing a quality improvement project just like you did, or similar to what you did, or they may be interested in doing something like you have conducted. The other thing is, it's just wonderful to talk with people and learn more about what they're doing in their part of the country, perhaps, or it could be international, some other country, and finding out ways that they're dealing with some of the issues that you have dealt with, either with your research study or the quality improvement. It also can be very less intimidating way of sharing your research study and QI project. Well, so what's a poster session? That kind of goes back to what is a poster. It seems basic, but let's just talk about that for a minute. Typically, poster sessions are time that's set aside at a convention or conference so that people can walk through, peruse all these different types of studies or EBP projects, or it could be QI projects as we're talking today. So it is very important that as they're doing this quick perusal, that the construction of your poster is such that it attracts that audience, and it really permits them to identify the key information very quickly. So we're going to go through 6 steps. They're very short, but hopefully they'll help you think about how would you do your particular poster. Now, the other thing I want to mention is that this is a general approach to construction of posters. This isn't specific for ARN, so this could work for any conference or any convention that you're attending that's asking for a poster and where you want to submit. If you have questions about specific to ARN, we will deal with those at the end of this session. So before you even begin to even think about laying out the poster or sketching it out, what would you do? Like everything else, you develop a plan. And if you were writing a paper, you don't typically just start writing, you start thinking about a content outline. how do I want to lay this out? What's a logical approach? So with this type of thing, you want to develop a plan, and you first start out with, am I presenting research? Because it would be different than if I'm presenting QI or EVP posters. It's really important to think about ahead of time, who is your audience? For example, is your audience a multidisciplinary audience? So they may not all know all the terminology that you use. It could be a healthcare providers in general, but still multidisciplinary. Are they nurses? And even if all are nurses at this particular conference, they may not be your specialty or your subspecialty. So all of this needs to be looked at, because then you start talking about what's the audience's level of knowledge about your particular topic. It gets into the verbiage you use, and this is why it's important for you to think about. Then what are the poster requirements? Now that's absolutely necessary, isn't it? So any conference that you're going to submit to will give you guidelines for the poster, like what size it needs to be, how it can be submitted, what format, how it's going to be displayed. All of those kinds of things are very important information that you need to think about, even down to acknowledgments, like disclosures might be something that's expected. So think about this plan when you are actually in the throes of developing and constructing a poster. The next step is really important also. Once you've got that plan in place, now then, this is another part of planning. You lay out your headings. Remember, we talked about that content outline. So what are the headings? You're going to have different headings if it's a research study versus a QI. Now, EVP might be also different, but we're just talking about the two right now. So I'm going to talk to you a little bit about research headings first. These are really the sections that you're going to be dealing with and actually writing verbiage for. So first is going to be your title. It's usually a banner at the top. It should be catchy. Sometimes you have a limitation on the number of words, even though that may not be the title that you had for your particular study. It has to be comparable, obviously, but you may be asked to shorten it. Authors and their affiliations ahead of time, just as if you were writing a manuscript for publication, you talk to your team. If you have other people who have worked with you. Now, if you're done it alone, or maybe with the statistician, maybe it's just the two of you. But if you have a team, think about who's actually going to be a co-author, or the principal investigator in this case, and a PI or co-PI with you. One of the reasons I want to talk about that is it becomes an issue sometimes in terms of who is the author of a poster, just as it would be in terms of a publication. Think about your team. If all did not help write this or put the poster together, think about them down here in the acknowledgments. It's not that they're forgotten. It's just that they don't necessarily need to be at the authorship. So you do need to discuss that ahead of time. So for the other areas, you would start with introduction and background. Now that sounds like, well, gee, that could be just one sentence. No, what would go into your introduction and background for research would be certainly, what is the problem that you're dealing with? What is the purpose of this study? And if it was experimental, you would talk about your hypotheses if you had them. If it's qualitative or non-experimental, you might have had research questions. Those need to be included. If you had a theoretical framework, it needs to at least be acknowledged. And then, of course, the significance to healthcare and to advancing the science. And that is typically in that section. So again, when we're talking about this, it seems like a lot of information, and that's why getting the key information is so important. Then the methods section, as in research, would be your population and sample, your design, your procedures that you went about in terms of collecting data, the types of measurements or instruments that you used, IRB approval, all of those things go into the methods section. Results, this is where I would really encourage you to think about graphics. It's not that you wouldn't use any kind of statements or bulleted lists, but having graphics really can capture a person's attention, and it's an easy way of getting across information. And then, of course, you have your conclusions and recommendations. Now, let me help with that a little bit. Normally in a manuscript, it would be called discussions. And it may be called that when you are asked to fill out a poster area for a particular conference. However, you're not going to be able to write all of that information, just as all of these areas are going to have to be shortened somewhat. So think about, most of all, what are your conclusions and what are the recommendations for future research? You may be asked to write implications for practice. Be very careful with research in writing implications for practice. Why? Because you do not want to take one study and assume that this is going to change practice. That is not typically done. Many times the population or the sample does not totally represent the population. So we have to be very, very careful with that kind of information. And then you usually have a reference list. Now, remember, in this case, it's not everything that you ever used for your study, or what you might have even had if you did a dissertation or a thesis or whatever, but it's just what was cited. And primarily it's going to be what was in your introduction and background. That's where most of your citations are going to be. And whatever you cited, that's what you want to have in your reference list. And then acknowledgments. If you were funded, you definitely acknowledge the funder. And then this is again where I was talking about, you could acknowledge your team or others that you feel have been very important. For example, if it's a dissertation, your advisor, your dissertation committee. So this is just the headings that we're talking about right now for a research poster. Now, QI poster, similar headings, but a little bit different wording. So first, title, authors and their affiliations. It's the same thing. You still want to work that out with your team. The problem and aims. Now, your problem usually comes because this QI is usually organizational dependent. In other words, it comes out of an organization that's probably following different trends and keeping data. For example, if you were keeping data on falls and on one particular unit, you had an increase in the number of falls. This is a problem. So this could be a quality improvement area. And then what you would do is write an aim. Now the aims are specific and they're measurable. And so that would go in a box, so to speak. And then you've got your heading for QI model or approach. What does that mean? Well, there's usually a way that you're going to do your actual model of improvement. So sometimes people do different ways. I'm going to use the one that I think is the easiest and that's used most often is PDSA, Plan, Do, Study, Act. That is just the approach to being able to do the entire quality improvement project. And then you talk about your intervention or the change. How did you go about that? How did you implement that? Then you'd have a results section. Same thing. You can use graphics here. They can help really illustrate very well what really your results were. And it's such a quick way of getting that information out. Standardization of change. What does that mean? Well, you may not use that word, but it's basically getting at, okay, if this was a successful project, is this something that you're going to now adopt for just your unit, maybe for other units, or for the entire organization's, the whole system? That's what standardization of change means. It may be that you'll have to abandon it because this particular intervention did not work and was not successful. Or it may be that pieces of it worked and you're going to adapt it, and then you go through that whole, PDSA cycle again, the whole quality improvement, which is continuous quality improvement, isn't it? So this is the kind of thing that you're going to have for a QI poster. And then again, same thing with references, just the cited sources, and your acknowledgments are similar. Funding or team, those are the major areas. You could put in disclosures, of course, add that as a piece if that's required by the particular conference or convention. So step 3, now we've got our headings. Okay, what are we going to put under those headings? And sometimes you are limited. You have to really think about this, limited to verbiage under each one of those headings. And I'll show you a sketch out in just a minute that gives you some idea. It's just a guideline, certainly not for you to hold to 100%. But one of the things to think about in terms of writing your content is you have to be cogent, meaning be clear, be logical in your thinking, and be compelling. So you cannot write long narrative sentences. You would never have room, and you can't cover everything you've done. Again, this is a visual presentation. So what you're doing is trying to engage your audience. So what's important, get that key information. Really think through how you write it. Use terms your audience knows. You don't want to use terminology, if especially multidisciplinary. Don't assume that even if it's a healthcare conference, that everybody knows your particular topic or your particular specific terms in your area. So be very careful about that. Write out acronyms. We do that when we write for publication. You would do it for a poster. So for example, you may assume that everybody knows what a CAUTI is, but you can't do that. So you write it out and then you put a parenthesis behind it and put your acronym. I'll give you an example. I have done my posters several times on breast cancer survivors, exercise and rehab. And I use American Cancer Society data sometimes, and I will have ACS. I do print it out the first time and then have, or spell it out the first time, and then I'll have an acronym behind it. But I just made an assumption that everybody knew what ACS is. And I thought, I wonder why you have to do that really. Well, I have a son who his degree is in chemistry. And he also likes ACS, but it's not the American Cancer Society, it's the American Chemical Society. So it's really important that we spell them out. Use bulleted lists when appropriate. This helps you not to have sentence after sentence after sentence. Sometimes break it up with some bullets. And then be consistent with your fonts. Now, fonts are different. There's serif fonts and there's sans serif. And sans serif or sans serif, people pronounce it differently, is without serif. And what is a serif? It's these little areas that, like right here on the T, if you can look at the T in my title, it's got a little twist to it. That's a serif. It's something that has been added on, like a little stylish piece. Now look at the T in tips. That's a straight T. There's no little ends, little, I guess you call it curly Q on the end. It's very straight. That is a sans serif, and I would recommend that. Use just very straight. And so you may be required actually by your conference that you're not allowed to use, or they don't recommend that you use, I shouldn't say allowed, but that they don't recommend that you use serif because it's not as crisp. So again, 2 fonts, and then when you're looking at size, this depends if you are developing a poster for on-site. If it's on-site, think about people being about 5 feet away. Remember, they're perusing during that poster session, and so to capture them, you've got a title that's going to be much bigger, and so 80 to 100 points. That's large, and then your names, your headings. And then they do recommend sometimes Times New Roman for text. I think that's debatable, but that's certainly a guideline by some. And then step 4 gets into the layout. Now we're going to talk a little bit about what the layout looks like, and then I'm going to show you a diagram, or share with you a diagram of both a research and a QI. So the layout is how you organize or arrange those headings we talked about, and then all of the verbiage that you're going to have underneath them. And then one of the suggestions, and this is really important, much like you would write out a content outline, take a piece of paper and sketch out these headings. And then even just sketch out the headings and draw a little box for what you think is going to be the verbiage, but lay it out as you think it would be, so that it could be, helpful before you actually go in and type this up. Once you do that, then you're going to also have to figure out, have I got too many words? Type those words, put them underneath that heading. Just kind of see how this is going to lay out. Do I have too much verbiage in one area or another? You want to always think, if it's in English, which most of our conferences nationally would be from left to right in terms of reading. So create a banner at the top. That's going to be large, and that's the one that's going to have your title, and under that your authors. Then think about these columns. Remember all those headings we talked about, the introduction or the problem and the aims. Think about those about 2 to 4 columns, and you're going to have some space in between those columns. You don't want them just smashed up together. Allow white space, which is what I was talking about, on the margins of the poster. So that's actually on the margins, but I would say also in between your content. And then try to be consistent in the amount of space so it's fairly even. Another thing that's important is the use of color. Now, you would think that the brighter the colors, the more attractive, and that would bring people to you. Not necessarily. It may attract, but it also can distract. So too much bright coloring on your poster, I think, is a negative. The other piece to think about is light text on dark is really difficult to read. So think about dark on white. So one of the things I've noticed is if you use PowerPoint, for example, as I am today, if you would download a shape, typically the shape will come down and it'll have a color. And then and I'm just going to say blue. And when they have a little text box, when you go in, it's often white text. So it's kind of the opposite of what I'm saying here. I typically will change that color and then change the text to black or a darker color. So just think about it, work with it a little bit, see what you think. It's also recommended not to use red or green that are adjacent to each other. It doesn't mean they can't be on your poster, but maybe not adjacent right next to each other just because of the being a color vision deficiency. Now I want to talk one more piece here about graphics. I'm sure many of you have been to poster sessions, and one of the things that I've noticed is it may attract someone to your poster if you have a huge graphic of, I don't know, of a patient that's doing a particular, whatever the intervention you had them doing, or some huge graphic, not just your result graphic, but really some other kind of display. And I would say that many times when it's that large, it takes away from really the content. You want your content to be substantive. It's important, it's quality. Even if you have to shorten it, it needs to be quality information. Having a huge picture that takes up most of your space is not helpful. But having a picture that might be important, and I'm going to give you, not that my posters, I have a lot that I would do differently if I could do them over now, but I will share one thing that I remember was a positive. Besides the graphic that I used a pie chart, as I recall, but I also had a picture of one of our patients who gave us permission to use it, of her. She was a breast cancer survivor doing fitness exercise, and she was laying on a mat and she had a barbell, and we had a picture of that. It was in color, and it was not a huge picture on my poster, but the thing of it is it really captures, it was that visual depiction of exactly what my study was about. And so if you can find something like that, but not make it too big, that's, I think, a good way to sort of attract people to your study. Now, this is just an example of a layout. So we talked about those headings. You can see that, the verbiage that goes underneath it. So this is for a research study. You can see exactly the layout. The logo may well be your health system. Healthcare system could be a university. It depends where you're coming from and whether they are okay with you using the logo. So that's another thing you would have to check out. But if you've done something QI project in your organization, they're going to want their logo on there. This is research, so just kind of take a peek at the different layout with your introduction, background, your methods, results. Above that, you've got a pie chart here, discussions, acknowledgments, references. And then I didn't mention before the contact information. This is an email. You could just have your email right there, and we'll talk about other ways that you can get that information out in just a moment. So this is, again, for research, and this one is for quality improvement. Again, none of this is hard and fast, but just think of it. It has to be a logical progression of thought. And so that's however you're going to lay it out. Think from left to right, and however you're going to do it so that the person flows with that thought. And so this one is problem and QI, and then your implementation, your results, and standardization of improvement and acknowledgments. Again, see, I have references and acknowledgments in a different place. Again, just an idea, but important for you to think about the layout. Now, what we're going to do now is I'm going to take you onto the internet, and hopefully it works. But these are for poster templates. Now, I want to say, disclose for sure, I have no relationship with Tufts University or with Vanderbilt. You can go to any university. In fact, if you're affiliated with a university, go to their library. I bet you they have some kind of support for producing, graphically designing posters, printing, what have you. So that's a good way to do it. You can do it online. There may be a university that you want to Google and see if they have this kind of information. Most of the universities or colleges, larger colleges, do have something that you can use that really give you good tips on how to develop a poster, and will give you to actually lead you to, for example, the Microsoft PowerPoint, which is one way that you can use a template for posters. Now, the other piece is with universities and colleges is that they often will have, through their library system, typically, they will have a program on how do you do a poster on using PowerPoint, or how do you do a poster point using Microsoft Publisher. So check those kinds of things out. If it's a healthcare system, they well may have, if it's a large one, they may have a graphic and printing department. Check them out and see, do they actually print, will they actually print your poster? Are there any graphic designers? Those are the kinds of things that is helpful for you just to check out. But this is where you can do it yourself. What I would encourage you to do is just look at, you can go online and you can, as you go into each one of these areas, they will have all kinds of different areas where you can, it says, how do you plan your poster? How do you present your poster? What are the kinds of templates you can use? And they give you examples. So these are just two, but I thought, I'm so sorry that it didn't work for you to see it. I'll have to figure out how to do that next time. Same thing with printing. So I was going to take you to these sites. These are just, again, the intent was to show you prices so that you could see what are some of the prices for the different sizes. Now, one of the things you have to think about, again, you can do this through, especially if you're a student or you have some affiliation with the university, check it out, because very often they do the actual printing for you. They're typically, even for students, there's a cost. I would say, depending on the type of, for example, type of material you use, it could be a little over $100 all the way up to over $200. And it perhaps could be more depending on where you live. But it typically is based on, is it laminated? In other words, is it covered to be protected with some kind of a lamination, or is it a special fabric for traveling? Or is it a regular kind of paper product that's nice and stiff and won't tear easily? Those are all the kinds of things that you look at. When you go into pricing for the printing, there are commercial places. I'm not going to mention all these names, but one of the things you need to think about in going to any of the commercial places that have office equipment, et cetera, and do these kinds of printing is the size. What is the capacity for them? For example, if you wanted to do a 48-inch by 96-inch or a 4x8 poster, which is not an uncommon size for conventions, if you were doing that particular one, some of the commercial places don't have equipment to do that large. And so they're limited in how big the poster could be. So those are the kinds of things you also need to think about. Both of these sites I encourage you to go to just to get an idea of pricing again. And I'm sorry that they didn't show. Oops. So then we're getting to step 6. Have poster will travel. Now you have it printed. So what you want to think about is getting it to wherever you're going. So if you are doing an on-site, this is what on-site is for. But even if not, this is where, if you're doing a virtual presentation, which Dr. Sadalia Vital will be talking about that on June the 29th. We're excited about that. So she will talk about the virtual aspects. This is if you were actually traveling and doing an on-site with a poster. You want to protect that poster. So consider buying a case. They're cylindrical. They're really not that expensive typically, and it would be worth your time. You want to prepare handouts ahead. One of the things that you might think about is to have abstracts so that you can hand out abstracts when you are on site. It may be also that you're allowed to do that when you do virtual. Just kind of find out that information. Bibliography versus references. The bibliography would be any of the information that you want to share with others, chapters in books, articles that you've read that have to do with your study, but were not necessarily cited on your particular poster. You could have a separate list for that. Business cards. I think those are really important. I happen to be one who forgets my business cards, but let me tell you that's very important to have. When you do that networking, sharing your card or getting the card from the other person you're talking to is really important. So do carry those with you and have plenty on hand. And that if it is on site, be sure you know how it's going to be displayed and bring the appropriate hanging devices. Can be push pins, tacks, some kind of adhesive, whatever you're told to bring, just don't forget to bring them. Sometimes those are not provided for you, and it is up to you to take care of. So have poster with travel, and that's important. So let's go through our, for some reason that's not moving. Let's go through those steps again. We've got 6 of them. Develop a plan, identify your sections or your headings, write your content, lay out your poster, sketch it out. And then once you've gotten it all done, you'll probably do it in a PDF, save it in a PDF, print your poster, and then have poster will travel. So watch webinar 3 and 4. Now the one that's going to be shown is webinar 4 on June 29th, and it's tips for displaying your poster virtually. We'll have another one for in-person that's going to be developed. And finally, we'll have one about how to write your abstract for a poster presentation. But webinar 4 should be June the 29th, and we look forward to you participating in that. And that's the end, and here's the references. And I thank you so much for participating in this particular session.